Germsday Thursday.
Today is Germsday Thursday. Today's germ topic is on that of Corynebacterium Diphtheriae, also known as diphtheria.
It's Germsday Thursday. Time to learn a little bit about different germs. Time to learn about that bacteria and those viruses. Don't forget the fungus among us.
But first, welcome to my YouTube channel. Welcome to my nursing channel. My name is Nurse Master Charlie. If you are a returning visitor, then welcome back and a big thank you for your support. If you are new here, then welcome. I'm glad you are here. Hopefully we can become virtual friends and or virtual colleagues. On my channel, I talk about and share about nursing school related topics and tips, as well as health related topics. So like I mentioned, today's germ topic is on that of Corynebacterium Diphtheriae, also known as diphtheria. Have you ever wondered why you received a vaccine for diphtheria, more likely as a child, or even what diphtheria is? Actually, you probably never even gave it a second thought. Now, in regards to vaccines, whether it was for yourself or for your child, you have probably heard of diphtheria, but in the form of its abbreviations. It took a form of a D and a T, an A and a P in some shape or form. Whether it was DTaP, Tdap, DT, and TD, not STD, but the D and the T and the P, which are short for diphtheria, pertussis, also known as whooping cough, and tetanus. These are a combination of vaccines against these particular infectious diseases. I'm going to share about the diphtheria part of these three, diphtheria, pertussis, and tetanus, in this video, but I will share and describe about pertussis and tetanus in my other up-and-coming Germsday Thursday videos. I'm actually going to be doing a series of videos about most of the vaccines that are needed for children from birth to 18 years of age, and also those for adults, including pertussis, tetanus, measles, mumps, rubella, polio, pneumonia, shingles, rabies, and smallpox. So be sure to find me every Thursday to every other Thursday for a Germsday Thursday video. So who should receive the diphtheria vaccine? Those younger than 7 years old receive the DTaP or DT, and those older than 7, including adults, should receive the Tdap or TD. And according to the CDC, adults should receive the Tdap or TD vaccine every 10 years. So why, you ask? Well, here's why. Diphtheria rarely occurs in the United States and Western Europe, where children have been vaccinated. So why even talk about it? Well, the reason it rarely occurs is because we are vaccinated against it. But where vaccination rates are low, such as in developing countries, diphtheria is still quite alive and common. And with our current ability to travel the world, why not prevent such an illness and minimize our exposure risk? So what is this diphtheria? Its name is from the Greek, diphthera, which means leather hide. Now, diphtheria is a serious infection caused by a bacteria named Corynebacterium Diphtheriae. This bacteria produces a poisonous toxin that causes extreme illness and even death. Diphtheria was discovered in 1884 by two German bacteriologists, Edwin Klebs and Friedrich Lofer. If you did not know what diphtheria was or is, and how deadly it still is, before the vaccine existed, diphtheria was a leading cause of death in children in the United States and also around the world. Historically, before the vaccine was developed in the early 1920s and then became a mainstream vaccine in the 1940s, diphtheria was one of the most feared infectious diseases. It was once called the strangling angel of children and can be actually traced as far back as the 4th and 5th century BC, where it was described by Hippocrates, the father of modern medicine. The reason it was called this was because it was one of the most common causes of death among children. Diphtheria epidemics in the United States and Europe resulted in a fatality rate as high as 40%. That means if 10 children contracted diphtheria, 4 of them would die. As I mentioned, nowadays, diphtheria rarely occurs in the United States. Why? Because of our immunization program. In the rest of the world, diphtheria does continue to cause illness and death. Diphtheria damages the body from the toxin that is created by the bacteria. I don't think we are safe in the United States, because if we decide to forego the diphtheria vaccine, there would be outbreaks as there was in the recent as 2018. The World Health Organization estimated that there were more than 16,000 new cases of diphtheria around the world. So if you think this virus is dead and gone, think again. So how is diphtheria spread? Diphtheria is spread from person to person from coughing or sneezing, which creates droplets and enter via the respiratory tract, and through contact such as touching of any open sores on skin. This diphtheria bacteria can result in either respiratory diphtheria and or a diphtheria skin infection. In respiratory diphtheria, signs and symptoms can include cough, mild fever, weakness, sore throat, swollen glands in the neck, resulting in a bull neck, like this picture. The bacteria get into and attach to the lining of the respiratory system, creating poisons and killing healthy tissues in the respiratory system. This can then create a dead tissue, forming a saran-like covering on tissues in the nose and throat, basically the mucous membranes, resulting in difficulty breathing and can lead to suffocation. This saran wrap covering is technically called a gray pseudomembrane. Respiratory diphtheria has a high mortality rate. Even after treatment, about 1 in 10 patients with respiratory diphtheria will die. And for those without treatment, up to about 50% of the patients can die from this disease. Diphtheria skin infections do not usually cause any other severe disease besides their own skin infections, like this picture. Diagnosis occurs by obtaining a sample from an open sore and growing bacteria to see if it will produce the poisonous toxin. So how do you treat diphtheria? Diphtheria is treated 2 ways. First, to treat the respiratory diphtherial infections, the bacterial toxin must be inactivated by an antitoxin to prevent the saran wrap-like covering from covering the mucous membranes. If it is highly suspicious that the patient has respiratory diphtheria, treatment should not be delayed until a definitive diagnosis can be made. Secondly, the bacteria must be treated using antibiotic therapy to actually kill the bacteria. So how do you prevent diphtheria? The main prevention of diphtheria is through vaccination via an intramuscular injection. If a person suspects that they have been exposed to someone with diphtheria, then they should consider speaking to a medical provider for treatment. And for nursing, if we were to encounter a patient with diphtheria, how do we care for them? From a nursing perspective, nurses are going to assess and monitor the patient's temperature, oxygen saturation, respiratory status, and perform interventions such as administer antipyretics, oxygen, and antibiotics as ordered, and encourage fluid and nutrition to promote healing. So if you found value in this video and learned a little something, please be sure to give this video a like as it helps out my channel. And if you are interested in nursing related content like this, I'd like to invite you to subscribe and be part of my little nursing channel. And also hit the notification bell so you can be made aware of when I release new videos. Also, don't forget to share this video with those you know who are in nursing school, starting nursing school, or pre-nursing, or anybody who may benefit from this type of information. Please be sure to check out my many other nursing topic related videos, my nursing related music lyric videos, and my YouTube shorts, in which, like I mentioned earlier, I created Germsday Thursday, which are normally done in a shorts format with a duration of 30 to 60 seconds. But in this series, they are not going to be done as shorts. They're going to be just a little bit longer videos because I cannot present all the necessary information in such a time frame of 30 to 60 seconds. This series is going to entail the various germs that are associated with the most common vaccines and immunizations given to us in the United States for school, work. These will include diphtheria, pertussis, tetanus, or DPT, and MMR, or measles, mumps, and rubella, to name a few, and many, many others. My other shorts include Medication Mondays, in which I highlight and share general information about certain medications, and Sweet Saturdays, in which I share and compare the amount of sugar in certain food products. So be sure to check those out to learn some quick tidbits of bonus information. And if you didn't know what I was talking about when I mentioned my nursing songs or my lyric videos, which are actually here on YouTube, I also write and create nursing educational music. You can listen to my music on almost all music streaming platforms. Also, be sure to check out my nursing blog on my website, www.nursemastercharlie.com. I'll leave a link in the description. So be sure to find me every Thursday or every other Thursday for a Germsday Thursday video. So until the next video, God bless and goodbye.
Germsday Thursday. It's Germsday Thursday.